Okay, anesthetize. This is how, so all on 4 is a little different than, you know, you're taking away bone. So this is where I anesthetize. 1, 2, 3. So as far as how much I'm putting, so I use Septo, okay? Some doctors use Marcaine. I have Marcaine too. Sometimes I use Marcaine for infiltration. But Septo is like my big one. I don't know if it's just because that's what I was trained with. It's worked good. There might be something better. You guys might have something better. Septo is what I use. If the patient's awake, I'll use sit-nest first, no epi, right? So it doesn't hurt. But most of my patients are asleep. So I just use the Septocaine, and it's just really quick. Once they're asleep, I'll push a little bit of propofol. I know, don't fall over. Oh my gosh, propofol. No, it's fine. If you have to check with your laws, but I'll do typically a half to a third in each spot. Boom, boom, boom. Here. This is the biggest one here, and here you got to get this really well. This is kind of where that I don't know what that, you know, the one that goes right way up in there that we could never get in dental school. You don't know how to do that really well and nail it every time? V2, that's what it's called, right? You learned that one?
I learned that.
I know. I think I've hit it once. I don't know. I guess if you keep poking around there, eventually you're going to find a hole. And
I'll let you try it on Sam. He wants to go.
well, maybe I'll try today. But seems like a simple thing. But Steve was always asking me when he was here, where do, you know, and the one thing I'll make fun of Steve is that when I'd come in and I would check his work, a lot of patients were moving. And I'd say, I'm pretty sure it's because he's feeling something. And typically his biggest mistake was that he would put it right under where the apex of the tooth was. And that you have to get up, you're looking, like literally you're pointing here. You're pointing here, literally, you're going into the soft tissue. You'll see it, I'll put it on my camera. But you got to get more up in the soft tissue. You can't go right at the apex. Because if you go right at the apex, there's so much other, I mean, you have to reflect so much more. And if you don't do it higher, then you're going to have so much blood. Yeah. Does that make sense? And you can't see things very well. So you got to, this may seem excessive, and I don't know if some of you guys are probably thinking, calculating, how much is this, right? I know you guys can calculate, and you know what? You know, again, I qualify my patients. If they have heart issues, then obviously I'm going to modify this, okay? This is definitely on the higher end, but they have they're healthy, no heart issues. I don't even think about it. I use as many carpules to get this done, okay?